Good afternoon. As Attorney General, I serve a mission that every Kentucky family ought to be able to live in a safe neighborhood and have a real path to prosperity. There are so many threats, so many challenges to that reality. Child abuse, sexual assault, human trafficking, violent crime, and senior scams all threaten our families across this Commonwealth. But the single greatest threat facing us as a state is our drug epidemic. Our reality is scary. Overdose deaths are up 11.5%. We lose 30 Kentuckians every single week to a fatal overdose. Every day I meet another person scarred by this epidemic. Yesterday, it was a woman who had found the body of her sister who had passed away from an overdose. The day before, yet another parent that had lost her son to an overdose. Since day one, I've dedicated this office to finding real solutions, not through talk, but through action. And I'm here to say we have made progress. We've distributed nearly 45,000 drug disposal pouches to communities throughout this state through the Kentucky Opioid Disposal Program. Those pouches can safely deactivate up to 2 million opioids. That's right. With help from folks like Sheriff Ward, the Attorney General's office has helped clean out nearly 2 million opioids from Kentucky's communities. We've cracked down on rogue Suboxone clinics and prosecuted doctors that take advantage of those that need our help the most. Our HIDTA task force in London is making sure that a pill mill never opens up in this state ever again. We work with the DEA to catch those dealers of death, those dealers of fentanyl and carfentanil, drugs that can truly kill you the first time you try them. We've gone into communities and hosted drug forums, making sure that everyone in all of our communities understand the threat that we are faced with and what services are there to help their people. We continue to push for legislation that will give law enforcement the tools they need to put dangerous traffickers away and for dedicated funding that will give us an opportunity to provide the treatment and the recovery that get our people better, that get them back with their families, that get them in a good job, and that ultimately heals our Commonwealth from the pain of this epidemic. We provided over $8 million in drug treatment funding all across this Commonwealth and another $2 million for the Rocket Docket program. But we cannot hope to stop the devastation of addiction until the root cause is addressed. This epidemic is where it is because irresponsible drug manufacturers and distributors intentionally flooded our state with dangerous pills. These companies knew how dangerous their opioids were. They knew countless Kentuckians would become addicted and that countless Kentuckians would die. But they flooded this state with pills anyways. So I'm committed to holding every single one of these opioid manufacturers and distributors accountable in a Kentucky courtroom. To date, we have filed 8 separate lawsuits, one against Pharmaceuticals, another against Johnson & Johnson, a third against AmerisourceBergen, a fourth against Cardinal Health, a fifth against McKesson, a sixth against Mallinckrodt, a seventh against Walgreen, and the 8th against Teva Pharmaceuticals. Today, I'm announcing our 9th lawsuit. This lawsuit makes Kentucky the most aggressive state in pursuing these companies in the nation. And it makes the Attorney General's office the most aggressive AG's office out there in ensuring that these manufacturers and distributors are ultimately accountable, that they must be a part of the solution. We have now filed more individual lawsuits against opioid manufacturers and distributors than any other state. Kentucky is leading the way. Kentucky is leading this fight. Today's lawsuit is against Insys Therapeutics, an Arizona-based manufacturer, and it alleges that Insys flagrantly exploited the market by fraudulently persuading doctors to prescribe the fentanyl-based drug Subsys for off-label use. Subsys is a fentanyl-based opioid mouth spray and was only FDA approved for cancer patients facing that type of pain. But Insys pushed doctors to prescribe this highly addictive, dangerous drug for non-cancer pain, including chronic pain. Despite the limited FDA approval, which means the FDA said it should only be used for cancer patients, Insys promoted and marketed its drug for non-cancer use and promoted it to non-oncologist doctors in Kentucky. INSIS sought to line their pockets by fraudulently acquiring insurance coverage approvals, giving kickbacks to doctors, and incentivizing its sales force to engage in unlawful and deceitful conduct. Our lawsuit cites numerous company emails and promotional materials that describe the company's alleged illegal and flagrant behavior. In one email, a company executive tells his sales force, "The bigger the script, the more money you make." Another company executive writes in an email, "What drives us all? Compensation." Even within the industry, INSIS is considered a bad actor, and sadly, that is hard work to be known in this industry as a bad actor. Federal prosecutors have indicted and arrested INSIS's founder and several INSIS executives alleging they conspired to bribe prescribers, many of whom operated pain clinics. And we in Kentucky know the pain of many of those clinics. According to our complaint, INSIS executives stressed the importance of, quote, owning doctors, which meant that the sales representative monitored and controlled those doctors' prescribing behavior. The lawsuit details how INSIS expected a, quote, return on investment, end quote, from doctors who participated in its speakers program, meaning the company expected the participating doctors' prescribing to increase. In fact, INSIS' illegal and deceptive marketing practices were described in detail in a 2018 United States Senate report entitled Fueling an Epidemic, inside the INSIS strategy for boosting fentanyl sales. We are filing this suit in Hardin County Circuit Court. We are making them, INSIS, come to one of our communities to make sure that this suit is in a Kentucky court where they have to face the families of Hardin County and the surrounding counties, look them in the eye, and explain their actions that have caused the addiction and death of so many. The Commonwealth is leading the country in our efforts to hold opioid manufacturers and distributors responsible for the devastation they have caused. We are aggressive, and we intend to be. We are the most aggressive, and we intend to be. And there is only more to come. So with that, I am joined here today by Sheriff Ward from Hardin County, Sheriff Pate from Breckinridge County, and we're going to hear a few comments from Sheriff Ward.
I'll be brief. The opioid epidemic touches all Kentuckians, and it touches all of our families one way or the other. And we in law enforcement, we sure appreciate our Attorney General, Andy Beshear, leading the fight against opioids in the Commonwealth of Kentucky. Thank you, sir.
Thank you. All right. Again, we appreciate everybody being here, and we will be back with even more steps to address this crisis. We won't stop until everybody's children are safe.